Our mission related to quality improvement is to provide the highest quality care in the most cost-efficient manner, and at the same time is keeping our patients safe and free from harm.
Sorry to disturb you, but I'm gonna be going home, okay? And Rosa's gonna take care of you now.
When we started this journey, we were about 18.9, almost 19 harm occurrences per 1,000 discharges. We're now around 4, which is an 83% reduction. That's awesome. However, if you're one of the 4, not quite so awesome. So we're not going to be happy until we're at 0. We really have focused on bedside communication. We're really looking at the safety huddles and trying to get staff throughout, no matter where they work or what they're doing, to look at our opportunities for improving patient care.
If there's any kind of a problem that occurs on one of the units or one of the areas, we're right there. We want to do a root cause analysis to analyze what happened, to make sure that that doesn't happen again and that we improve. It's usually improve our systems. If you work in a hospital any length of time, you know that the data that's collected has to go into a process to make sure that we are improving and that we fix the problem and then we go on from there. We'll work on it as a team with doctors, with nurses, with staff, pharmacy, whatever it might be. It's a team approach because nothing gets done in a hospital unless the teams are working together and respect each other in what we're doing. So I think we've arrived in that area and that we have to have a team and we have to work together.
I want to remind everybody to make sure you're doing your fire risk assessment at the beginning of your case, and that should be announced during your timeout.
We really look at that harm rate on a regular basis, on a monthly basis. If we see it, we report it on a quarterly basis as a hospital and are very attuned to if it's going in the wrong direction, if it's not going down, we have to continually drill down what's the driver of it not going down.
When we report statistics for risk reduction or harm reduction on a composite level, it gives an overall picture of the magnitude of the change that's actually has occurred. And specifically when we talk in terms of the reductions that St. Catherine's has been able to achieve as high as 86%, the board recognizes that that is a significant change. We also report in terms of the number of patients who were harmed per 1,000 discharges. And that makes it real to the board members who are not healthcare professionals because they can say, okay, out of 1,000 patients that were discharged here, we started out at this rate and now we've reduced it by 86%. That they can think of that in terms of real patients and real events in the institution. St. Catherine serves a very disadvantaged population. There's challenges with literacy levels. Many patients have limited financial resources, limited ability to understand English.
In responding to the needs of the community is that education, presentations, demonstrations, health fairs, outreach screenings, these are all important.
Want to know what went well Friday, if we had any issues that we need to take care of.
The overall goal is to educate as many members, not only of our healthcare team, but also those members within our community to understand is that by complementing some of the hospital strategies, we're helping them out as well, sustain a quality of life that they've always wanted.
What's been really helpful for us with the HEN and the HRET is the ability of sharing best practices and evidence-based care out there. We're a small institution. There's not a lot of us. We don't have a lot of time for doing extensive research. It's awesome to be able to go to the website and to see what are the best practices out there because despite our differences, we're more alike than we are different. We were identified as a mentor hospital in the state of Indiana. We have gotten calls. We're happy to share that. None of us have all the answers, but we can learn from each other. We're all about improving patient care.
We have to continue collecting harm across the board because it's our way of life now. It's our culture.